Physio is mostly focused on movement and the science that revolves around it. Many of us are unaware of it, but don't take this for granted. Physio is really increasing the recovery rate. Yes, gentlemen, let's walk to a pain-free life. Today, on our 46th talk, we have Mr. Sreejith M Nampoothiri sharing his wisdom on physiotherapy key to pain-free life. Before we begin, I would like to kindly bring your attention to the feedback link that will be provided during the session. Kindly fill the form and let us know your opinion. Also, please don't hesitate to mention if there is any requirement for the certificate of attendance. Moving on to the formal session, I, on behalf of the whole team of Intersociety Weekly Webinar Series of Talks, humbly welcome our most honored speaker, Mr. Sreejith M Nampoothiri, Director and Chief Physiotherapist, Executive Center for Physiotherapy, to the 46th talk of Intersociety Weekly Webinar Series. Welcome you, sir. I once again formally invite all the attendees of the day. We are very delighted to have you all online today. Without much delay, I humbly welcome Mr. V. Murugesh Kumar, sir, former Joint Commissioner, Taxes Department, to introduce our esteemed speaker. So please.
Thank you. So good evening to all. Indeed, it is a pleasure moment for me to introduce Sreejith M Nampoothiri to the webinar organized by IEEE Kerala. Sreejith needs no introduction to the related field in his homeland, beyond the state borders and the global outreach of his professional expertise in the field. Needless to say, clinical practice as a physiotherapist, it is a divine job gifted by God. One may be academically good in the related subject. What is more important is that the physiotherapist should have a blessed hand to diagnose the issue with the professional perfection, precision, and accuracy to get the miraculous result of physio treatment. Obviously, Sreejith is gifted with all these parameters. Apparently, there is a treatment to restore, maintain, and patient's mobility function and well-being. It helps through physical rehabilitation, injury prevention, health, and fitness. Physiotherapists get you involved in your own recovery. The ethical scale in the precision is very seriously followed by Sreejith in his professional career. My case is the best example of his professional perfection. During 2015, I am diagnosed with a thoracic compression myelopathy and loss of sensation of lower limbs. There is compression of spinal cord at level D9 and D10. The extent of disability was around 80%. I am unable to move out of bed and totally dependent on others for day-to-day activities. Long before the admission in a leading medical research institute, Sreejith started physio treatment. Immediately, he realized my neuro-related issues. In fact, he was the first one to hint the need for a surgical intervention, which came true at a later point of time. In the meantime, I was totally bedridden. Then airlifted to Aster City, Kochi for a world-class treatment. The medical board of neuroscience department of Aster decided to undertake the challenge and performed the most complicated spine surgery. It lasted for 13 hours and underwent decompression. I was in the post-surgical ward for 46 days. Then came the role of physiotherapy and effort taken by Sreejith. He administered aggressive limb and chest physiotherapy. Eventually, my lower limb power improved to grade 4+ within a short span of time. The treatment systematically continued for 5 years without break. Sreejith would spare 1 to 1.5 hours for every session. He has good rapport with my surgeon, Dr. Jacob Epen. They discuss and fix the modalities to be followed in my case during the initial stages of physio treatment. As of now, he has reduced the number of sittings in a week. During the turbulent days, he played the role of an excellent motivator too. Now I drive the car and free from dependency for doing day-to-day activities. I follow the health management tips given by him at all times. I am back to normal life, also blessed to have received the treatment of a divine gifted physiotherapist. taking the drive of hardcore physio treatment for such a long period with the utmost care may be a rarest one in the history of physio treatment. Finally, to say, this is a treatment to cure the pain with pain, to lead a pain-free life. Over to the presenter.
Sreejith sir, shall we have it, sir?
Yes.
So what do you, sir?
Good evening, everyone. First of all, I would like to thank Mr. Harindra sir, Chairman of Intersociety Activity, Dr. Shamala, Madam, for giving me an opportunity to be with you to share my something related to my profession, which is useful for the society. And I am thankful to Murugesh Kumar sir for having a lightning introduction. Good evening, all. Let us start. Today's topic is physiotherapy, a key to pain-free life. Am I audible?
Yes, sir, you are. Perfect, sir.
Yes. Before that, I'll just go through a few points regarding what is physiotherapy. As you know, physiotherapy is a hand-skilled art of healing. Physiotherapist utilizes his hand for getting relief of patients. The merit of physiotherapy is there is no medicine and there is no side effects. So there are a lot of doubts whether physiotherapy belongs to Ayurveda, whether physiotherapy belongs to allopathy. The academics is based on allopathic background, and diagnosis is by physical diagnosis and treatment by physical modalities. When a patient comes to physiotherapist, there will be a medical diagnosis followed with physical assessment and physical diagnosis and treatment with the physical modalities. You might be confused with what is physical diagnosis. I can tell you an example. A patient comes with neck pain. It is being diagnosed as cervical problem, trapeziitis. It is a medical diagnosis, and we do have our own assessment, and we might be finding the trapeziitis is due to overaction of the trapezius, which was due to dysfunction of the pectoral muscles. So our physical diagnosis will be pectoral dysfunction, and we will be treating with the physical modalities. That is the difference between medical management and physiotherapeutic management. Physiotherapist has different roles. Physiotherapist can practice independently and as well as complementary with medical treatment. It can either used independently or as a team member with other streams of medicine. Yes, there are 4 stages in physiotherapy. Physiotherapy act in prevention, in curing the disease, restoration, and rehabilitation. First we'll come to prevention. I can give you an example. A person who is known to work for a computer with a computer, and he is sitting for long time in computer and with a wrong posture, he is more prone to develop musculoskeletal injuries. If he is aware of the what are the correct postures and what are the things will be happening if he is not using a proper posture, what are the musculoskeletal injuries he may come across during his professional life. So we will be able to guide his posture, and we can prevent further or deterioration or getting chance for getting injury to the musculoskeletal system. That is the preventive role of physiotherapy. Then comes the curative. When there is a disease, we can say an example, a tendinitis, inflammation of the tendon on the shoulder. So that has to be treated. So physiotherapy plays a major role in treating musculoskeletal injuries with physical modalities and restoration. Let us take an example of a patient with a lumbar disc lesion. He might be cured or better with a medical treatment or surgical treatment, whatever it is. And he comes for physiotherapy. And after course of physiotherapy, he is getting cured of his symptoms. And when he is back to his job, his core muscles has to be strengthened and it shall be kept in right firing position. So we need to have exercises to maintain it. So in order to restore the muscle function, he need to practice regular exercises. So physiotherapy act as a restorative role. And next is rehabilitation. Rehabilitation is a teamwork. It consists of many professionals. Rehabilitation, the word rehabilitation means a person who met with an accident or with any disease, he is becoming disabled, and we are trying to make him back to possible normal life. That is the rehabilitation. Whatever things he was doing, or whatever possible level, we are making him back to life. That is rehabilitation. So physiotherapy acts as preventive role, curative role, restorative, and rehabilitative role. Yes, as you know, physiotherapy has a major vital role in orthopedics. You all will be knowing that after fracture or after a ligament injury or a sprain or strain or with all other injuries or after surgery, physiotherapy is absolutely needed for restoration of function or back to normal life. And of course, physiotherapy has a role in neurological disorders. Example, stroke is there, motor neuron disease, so many Parkinson's, so many neurological peripheral nerve lesions, like that. Neurological problem can be effectively cured or complemented with physiotherapy. And we have a major role in intensive care unit. You might be thinking, what will be the role of physiotherapist in intensive care unit? So we will be able to prevent the complications which can occur due to prolonged bedridden stage. In ICU, the patient will be bedridden, and there are many chances for getting pneumonia-like complications due to prolonged being in bed. So these type of secondary complications can be effectively controlled, prevented, or cured with the physiotherapy. And of course, in pediatrics, there is early detection and early intervention. The role of physiotherapist is detection of abnormality in early childhood. We all know, usually parents will be complaining that my child is not walking, he crossed the age of 1. But early in the intervention, we can, with the first week itself, we can find out there is a problem with his developmental milestone, and we will be able to, we need not wait for 1 year to diagnose it. Okay. In geriatrics, as we become old, there are so many adaptive complications associated with the old age. So difficulty in walking, difficulty in sitting, difficulty in getting up, and physical inactivity. So many things are happening. Even falls can occur. So effective management physiotherapy with the physiotherapy can prevent these complications. And comes to gynecology, there are postnatal and prenatal programs for during pregnancy and after delivery. There are a lot of adaptations occurs with the woman body during pregnancy and after pregnancy. These adaptations can be effectively put back to normal by doing effective physiotherapy. The complications associated with the delivery, such as incontinence of urine, flat belly, so many complications we can prevent with physiotherapy. And of course, with cardiothoracic diseases, with the bypass and after bypass, physiotherapy is inevitable for bringing back to normal life. And all of you know, physiotherapy has a major role in pain and palliative management. With a cancer patient, they'll be taking chemotherapy and other systems of other methods of treatment like radiation, etc. We'll be having so many adaptations and pain. In that, physiotherapy can help to reduce the pain and to maintain the function, possible function. And all of you know, in sports, physiotherapy plays a vital role in maintaining the fitness and also preventing the injury and also maintaining the form of the performer or the sports person. Yes, we'll come to our topic, pain. I think everyone might be experiencing pain in their life. So electrotherapy, physiotherapy has a major role. Electroanalysis is there. Without medicine and without side effect, we will be able to reduce the pain to a great extent. So for that, we will be using so many therapy streams like electrotherapy. In electrotherapy, we will be using specialized current like special frequency current like transcutaneous electric nerve stimulation, interferential therapy, ultrasound therapy, shortwave diathermy, laser, shock, etc. So we'll be giving some specialized current to produce a counter rotation and also to stimulate endorphin, which is a natural painkiller which can relieve pain. Next thing is exercise therapy. Exercise therapy is an important tool for physiotherapists. As a medical practitioner prescribes medicine, physiotherapists handle exercise in such a seriousness that we should select an ideal exercise for him, which should help him to cure his ailment. And next is cryotherapy. Cryotherapy, you all will be knowing that application of ice. I have a question whether for an acute injury, what shall we use? Whether we will use ice or hot? Usually the answer will be when usual practice is when we have an injury or a strain, we will be using heat. Whether it is right, whether we should use heat or cold, it's a major question. What will happen when there is an injury to a part? What will happen to the part? When we are touching the part, what will be the response? There will be local rise of temperature. Local rise of temperature is an early sign of inflammation. When we are giving heat to that part, what will happen? It will aggravate the inflammation. But we are getting some relief. It is due to reduction of spasm due to application of heat. But actually, we are aggravating the inflammation and signs. So we need to apply ice for an acute injury. First 5 days, it is better to use ice for relief of pain. Okay. Then we have the spinal and peripheral manipulations. When there is a back pain or a facet joint dysfunction or a neck pain or a shoulder or a knee pain, we will be able to correct the alignment due to alignment with the spinal manipulation, which needs high skill, and it is bit dangerous also if it is not performed properly. So we have other tool, soft tissue manipulations, which may be confused with local massage. So we will be finding the problems associated with the soft tissues like muscle, fascia, and superficial fascia, deep fascia, etc. And we will be manipulating the fascia or the soft tissue to cure pain. And there are incidents with when there is a cervical pain, cervical spondylosis, we may be experiencing pain down the arm, or when there is a disc problem, we will be experiencing pain radiating down the leg due to irritation of the nerves. This can be cured effectively or immediately with the nerve mobilization techniques, which is a very effective tool in reducing neural pain. So we'll go for the reasons for pain. The reasons are musculoskeletal cause, degenerative cause, systemic cause, posture, and poor ergonomics. So we'll go ahead with some musculoskeletal problems. Everyone know that many of us might have experienced heel pain. There are many reasons for heel pain. The picture shows a condition of plantar fascia. It is plantar fascia or a heel cushion. It has got inflammation, and the patient will be experiencing heel pain. The funniest thing is usually with the plantar fascia, it is early morning when we are getting up, we will be having pain on the heel, and when we start walking, the pain will be eased. And whenever we stop and sit for some time, the pain again comes. This is absolutely the symptom of plantar fasciitis. There are so many things can cause pain on the heel. In heel, there is a tendoaculous attachment is there. Any strain to tendoaculus can cause tendoaculous bursitis, and even with deformity in the foot can cause a strain or sprain to ankle, which may lead to heel pain. So this is an example of a deviation of arch. Usually, we will be having an arch on the foot, which is giving more stability and grip to us. And in some patients, there are chances for getting flat foot, maybe due to structural or weakness of intrinsic muscles. So this can cause the arch is being collapsed, and it induces overload on the it induces overload on the medial aspect or inside aspect of the ankle, which can cause strain to the ligaments on the medial aspect of the ankle, which may lead to inflammation and pain. The thing is, when there is an instability or a loading disorder in the ankle, it may affect the knee also. Eventually, as a progression, osteoarthritis of the knee also can occur. See, we will analyze the cause for the flat foot. So if it is due to weakness of the intrinsic muscles, we'll be able to strengthen the intrinsic muscles, and also with the physical modalities like ultrasound or TENS, will be able to cure the symptoms. And if we cannot, if the arch is being collapsed fully, we cannot strengthen the intrinsic muscle. So we'll go for an external support, arch support, which will fit correctly on the footwear. So such patient should use a footwear with a medial arch support to prevent further strain or injury to ankle. The other thing is ankle strain. What we can do whenever there is an ankle strain. If the strain is not so severe, we shall go ahead with the physiotherapy treatment. So we'll palpate the place of injury, whether it is on the medial aspect or lateral aspect. We can apply ultrasound therapy and tends to cure the pain. The first aid for sprain is ice, rest, elevation, and support. So we'll be applying ice for 2 or 3 times a day for 5 to 8 minutes, followed with the physiotherapy treatment and compression bandage and elevation of the limb. And when pain reduces, we'll be starting mobilization and also kneading to the part to prevent adhesion. These are the type of bandaging. We should apply bandage from distal to proximal. That means from the downward part to upward to prevent swelling. Then comes to injury to knee. Everyone knows that there are a lot of ligamentous support which is giving stability to knee. See, this is marked as it's a lateral collateral ligament injury. Central is medial collateral ligament injury, and last one is lateral collateral injury and ACL injury. These are the structures which is giving stability to knee. On the outer side, there's a lateral collateral ligament. Inner side, there's a medial collateral ligament, and inside the joint, there is a cushion-like structure called menisci. And in front of the knee, there is a ACL and anterior cruciate ligament, and in the back there is a posterior cruciate ligament. Any sports activity or any fall can cause injury to any of these ligaments. This injury need a specific care. If there is a torn or a complete rupture or a grade 3 or 4 stage of rupture, it needs surgical intervention and followed with the physiotherapy. The important part is rehabilitation part. We should do properly. Then only the patient will be able to perform like a previously. There are sort of lot of limitation for that. So nowadays there are arthroscopic surgery to cure the or clear the injury. After that, there are a lot of protocols when the patient should stand, when the patient should give weight to the limb, when the patient start walking, or what support he should use. These things should be incorporated with the experience of a physiotherapist to regain the function properly. When there is an immobilization, there are chances for wasting of the muscles around the knee. The major muscles are quadriceps in front of the thigh and hamstrings at the back of the thigh. And after the surgery, there are chances for getting stiffness to the joint. So the role of physiotherapist is to maintain the strength of the muscles as well as to regain the movement of the knee. This is the picture of a medial meniscus injury. It is medial and lateral meniscus injury. There are two types of injury. This is bucket handle injury. It resembles like a bucket handle, and the next is radial tear. What will happen if there is a meniscal injury? If it is being not rehabilitated or repaired properly, it's an intra-articular thing. That means it is inside the joint. If an injured or with a structure without a proper circulation inside the joint, there are chances for getting degeneration. So this has to be absolutely, it has to be cured. The role of meniscus is locking and unlocking. When there is an injury to meniscus, our locking mechanism fails and there are chances for falling down. So we need to properly treat the meniscus injury, whether if it is more, it is with surgery, or if it is a minor injury, we can treat with the physiotherapy. These are the structures which I have explained. These are simple exercises to maintain the strength of the quadriceps muscle. We are keeping a towel roll under the knee and just pressing to tighten the anterior structures. And this is a straight leg raise, which will induce or activate the quadriceps muscle. The next comes back pain. Is a major problem we used to face. When I was trying to pick up something from the floor, or when I was trying to get a cup of water from a bucket, suddenly there was a catch on the back. There are many possibilities. There is a chance for disc prolapse. There is a chance for irritation to sciatic nerve, and the major possibility is a sacroiliac strain, which will cause severe dysfunction and pain. Sacroiliac joint is a joint which transfers weight of the lower limb to upper limb. Whenever we are trying to sit, the pelvis has to rotate, and whenever we are trying to stand, the pelvis has to become erect. So this mechanism fails and there will be severe pain. So this can be treated effectively with the sacroiliac mobilization. So we will be mobilizing the sacroiliac joint and putting back into the normal position. And with the sacroiliac strain, there are chances for getting inflammation to the soft tissue around there. This can be treated with interferential therapy, icing, and ultrasound. With a few sessions of physiotherapy, the sacroiliac strain can be effectively managed. The problem is not solved. The symptom is being solved. The sacroiliac strain might be due to weakness of the core muscles. So we need to clear the sacroiliac dysfunction and the inflammation occurred due to sacroiliac strain, and we need to go for strengthening of the core muscles. This is the normal structure of a disc. Lumbar disc is a major site for back pain. Disc is a cushion-like structure filled with nuclear pulposus. It is filled with a fluid-filled thing covered with a fibrous annulus. Whenever there is a strain on the annulus, it may break, and the nuclear pulposus, that fluid may come out, which may compress the nerve, which can cause back pain, severe back pain, and compression of the nerve, which may produce weakness of the lower limb as well as radiating pain to leg. Usually, everyone knows that there are chances for getting sciatica. If the disc prolapse is severe and if it is compressing the spinal cord, there are chances for getting severe weakness to lower extremity, and there are chances for disturbance of in passing motion and urine. In this condition, surgical treatment is absolutely indicated, and physiotherapy is needed after the surgery. If there is no emergency situation like incontinence, physiotherapy can be effectively managed. See that when there is a disc prolapse, we'll be experiencing severe pain and compression of the nerve. This nerve compression can be effectively managed with the nerve mobilization techniques, and the pain can be relieved with the interferential therapy, which is a combination of two medium frequency current, which produces a deep low frequency in the disc space, so that pain and inflammation occurred there can be cured, and the function can be regained through core muscle strengthening and modification of the activity. There are so many do's and don'ts in case of patient with the disc prolapse. See, for a patient, for our normal daily life, we need to lift weight. But the instruction given to a disc patient is, you are not supposed to lift the weight. How can we live without lifting a weight? So we need to have a modified technique to lift the weight. The ideal thing is we need to kneel down, sit close to the object, and lift the object with the tightened abdominal muscles. And you need to have a regular abdominal exercise program. This is the picture of a sciatica due to impingement of the sciatic nerve, which is giving pain on the thigh radiating down the leg. This can be effectively treated with physiotherapy, as well as if it is severe, we may need to go to an orthopedician and have medical treatment along with physiotherapy. So there are a lot of when it comes to shoulder, there are a lot of soft tissues, tendon, muscle, so many things are going through going around the shoulder. Shoulder joint is the importance of, or the peculiarity of the shoulder joint is having more mobility but having less stability. As there is more mobility, as there is more movement, the chances of getting injury is high. So we need to have a treatment for this type of, there are chances for rotator cuff injury, there are chances for deltoid injury, there are chances for bursitis, there are chances for supraspinatus tendon, infraspinatus tendon, like that. So many injury can occur with the shoulder. So it will seriously affect our daily activity. The patient comes to us with pain on the shoulder and difficulty in lifting the shoulder. We need to assess each tendon or each muscle to find out the dysfunction. The success of the treatment depends on identifying the real cause of the pain. For a deltoid injury, it won't give any cure if you are not identified it properly. And we need to give treatment with the physical modalities, and we need to regain the function due to by strengthening. We have so many strengthening methods like resisted bands, Tara bands, and some isometric and isotonic exercises with the weights. And the thing is, which exercise is the selection of the best exercise is the selection of the best exercises will give a good cure. So there are chances for getting more injury to shoulder. Even backward movement can cause stretch to the tendon and can give to injury. And many of the diabetic patients are more prone to develop such injuries. Whenever there is an injury, our normal mechanism is we won't move the part unknowingly. We won't move the part fully. So muscle is an elastic structure. if it is not moved properly or fully for a period of time, this will go for adaptive shortening. So this can cause adhesive capsulitis, periarthritis like conditions, which is very painful and can cause dysfunction. So effective physiotherapy can prevent development of periarthritis or frozen shoulder. As I said, this is a picture of rotator cuff. Rotator cuff impingement can there may be a tendon impingement which prevent us to lift the shoulder beyond a level. So there are bursa around the shoulder which may get inflamed, and bursitis. Tendon around the shoulder may get strained, and there are chances for tendinitis. Rotator cuff muscle is giving stability to the shoulder. If there is an overuse of the tendon, this may get inflamed and dysfunction. So the role of a physiotherapist is curing this thing, tendinitis or the whatever pain or strain occurred to the shoulder joint, and we need to find out the cause of the strain. If it is a overuse, or if it is whether it is a weakness or due to some other repeated activity, we need to find out the root cause of the injury, and we need to cure. Otherwise, these symptoms may come. Okay. And everyone knows that as Sachin Tendulkar got tennis elbow, everyone knows that there is an injury around the elbow which can cause tennis elbow. The thing is that extensor muscles, these muscles are getting attached to this part, lateral epicondyle, this part, and the action of the this muscle is wrist extension, the movement of the wrist upwards. As there is an injury, if you are keep on moving, this won't heal. So we need to limit the activity of the wrist. So we need to modify the activity. For everything will be for lifting, everything will be lifting the wrist upwards. Lift the wrist upwards. This will induce strain on the elbow, and inflammation process will be going on. So we need to modify the activity along with the treatment. See, we can do everything in this direction. For ladies, for this thing, cleaning and all, they will be using the broom like this, which may induce further aggravation of the symptom. This can be modified this way. And those who are riding scooter, they will be giving accelerator like this, which is giving overload to the extended tendon and aggravate the symptom. So we need to modify the activity. So we won't be able to modify the activity of the acceleration, but we can just put it like this in a medium acceleration. And we can use a band, a tennis elbow strap, to produce a false attachment in order to not to create any strain on the injured part. And for physiotherapy, we have ultrasound therapy along with the TENS and tennis elbow strap. But we should find out the cause of the tennis elbow. We are giving treatment for the injury and inflammation, but it is not going. It might be due to shoulder weakness. If there is a shoulder weakness, we will be overusing the wrist extensors and creating tennis elbow. And maybe a wrong action of the wrist extensors can cause strain to extensor muscles and can cause tennis elbow. So we need to identify the exact cause. We are treating on the elbow and it is not going. If the real cause is a weakness of the shoulder, an expert physiotherapist can find out the reason and can cure the symptoms. The other part of the elbow, inner part of the elbow, it is medial part of the elbow, the flexor tendon, all the inside muscle is getting attached to the medial part of the elbow. If there is a forceful action of the muscle, it may get stripped and it can cause gold face elbow. The management is same. We need to find out the cause, and we need to treat the symptoms with the physical modalities. And the next is student's elbow. When we are keeping our elbow for a long time, as a student used to keep it on the table, this can cause strain to the olecranon bursa on the posterior aspect of the elbow. This may result in olecranon bursitis. This has to be treated, and the cause is prolonged pressure on the olecranon bursa. We can cure it simply by keeping the elbow outside the table. This is a picture of carpal tunnel syndrome. This is due to compression on the median nerve on the carpal tunnel, which is giving pain to wrist and numbness on the 3.5 fingers, which is being supplied by the median nerve. This might be due to wrong use of the wrist. If you are using prolonged use in a faulty posture, can cause undue strain on the wrist and may cause compression on the median nerve. We need to correct the activity, and through nerve mobilization, we will be able to cure the symptoms of carpal tunnel to a certain extent. For an extensive case, we may sometimes need to go for an orthopedic surgery or a neuro surgery. So these are examples for reason for carpal tunnel. When we are using wrist like this for a prolonged period, this may get undue strain to the wrist and can cause carpal tunnel. So, see, while using mouse, if this angle is not proper, this can also can cause carpal tunnel. This is also an example for chances for getting carpal tunnel. These are the right positions you need to use the wrist. Another thing which can cause pain to wrist is recurrence disease. This is an inflammation to a tendon, which is also due to repeated movements of the thumb. We need to have immobilization, and inflammation can be settled with icing, ultrasound therapy, and exercises. Then comes to degenerative diseases. Everyone knows that as age progresses, there are chances for getting arthritis. See what will happen with an arthritis. See, there is an articular cartilage. This is a normal knee, healthy knee. There is an articular cartilage which is giving cushion to the knee, and these two are the articular ends. Just see here, the articular cartilage is being reduced in its size due to reduction in water content, and the articular ends are irregular, which will cause restriction to movement, muscle weakness, and difficulty in walking, difficulty in standing, difficulty in stair climbing. So we need to treat it properly. There are many chances for this osteoarthritis. Obesity is one of the major reasons for getting osteoarthritis. There are chances for getting osteoarthritis due to secondary to injury, secondary to fracture, secondary to ligament injury, or even with angle deformity, osteoarthritis can cause. We need to find the cause, and we need to treat for pain, relief of pain, regaining of movement, and regaining of function. And we need to guide the patient what the do's and don'ts. Mainly, osteoarthritis results from prolonged standing and excessive stair climbing. See, when a person with a standing job, there are more chances for osteoarthritis. We'll take an example of a teacher who need to stand for long time, long sessions for class. So she's a most prone person to get osteoarthritis. But we can prevent it. See, there is no need to stand for long time. The teacher can walk and teach, so that prolonged standing or prolonged weight bearing for a particular period can be avoided, and the chances for osteoarthritis can be reduced. Then comes to cervical region. Everyone knows that the prolonged use or old age can cause cervical spondylosis, which may result in pain, restriction of neck movements, radiating pain to arm. See, here comes physiotherapist's role in prevention, curative, and restorative. and in there are nowadays we are getting young patients with cervical spondylosis due to faulty or defective posture. Posture is an important factor. See, when considering with the spine, there are three normal anatomical curvature. There is cervical lordosis, then thoracic kyphosis, and lumbar lordosis. All the structures, including muscle, ligament, tendon, nerves, everything is disc, everything is aligned according to normal curvature. If this is being violated, there are chances for getting strain to these structures, and whenever there is a strain, body starts depositing calcium and thereby reducing the joint space, and spondylosis can occur. And awareness of the correct posture is absolutely needed to prevent this type of degenerative diseases. When a person is sitting, just imagine when we are sitting on a computer, how will be our posture? How will be our posture? Or when we are driving, how will be keeping our neck? Or while watching TV, how will be keeping our neck? See, 99% of the patient or persons will be keeping their chin up like this. See, when we are keeping the chin up, the normal cervical lordosis is being exaggerated and can cause strain. See, just imagine we are keeping a helmet and we are riding a scooter. How will 99% of the people, how they will be sitting? See, they will be keeping the helmet on the head and keeping the head like this. This will induce pain on the neck, and eventually it can cause cervical spondylosis. Just correction of the posture can prevent this. How we will correct? Simply telling, we need to keep the chin parallel to the ground. See, there is no need of protrusion or this thing. Okay, we need to keep the chin parallel to the ground. Just tuck the chin and use the eye movements. So we need to correct the sitting posture also. So our head is having a weight of some around 10 to 15 kilos of weight. When we are keeping the chin protruded, how it will be? The weight of the head has to be counterbalanced by the posterior muscles. So the posterior muscles has to strain a lot to counterbalance the weight of the head, so that it induces undue strain on the posterior muscles, and eventually there are chances for getting high chances for getting strain, and it may cause pain, and it may progress to cervical spondylosis. This is a picture of cervical spondylosis. Here the cervical lordosis is being changed. This is another picture showing exaggerated cervical lordosis. Cervical lordosis is being exaggerated, which may cause compression on the disc and nerve. This is MRI of a cervical disc degeneration. This is the spinal cord. This is the vertebra. This is the disc which is being getting compressing the spinal cord, which may induce weakness, pain, and numbness. This is due to faulty posture only. If we were able to correct the posture initially, this might not have happened, and we need to have symptomatic treatment with postural correction and physical modalities. There are some pictures showing how we need to sit. See here, lumbar lordosis is being exaggerated. See here, the thoracic curvature is being exaggerated, and this is the correct posture. That means he is keeping normal cervical lordosis, normal thoracic kyphosis, and lumbar lordosis. Sitting like this will reduce the strain on the lumbar disc and other musculoskeletal structures. So these postures we come across every day in the society. See, this is the thing which I have told: protrusion of chin forward. This induces lot of strain to posterior structures, posterior muscles, which may cause permanent soreness to the pain. Simple correction of the posture can cure the symptoms. This is the correct posture. chin is parallel to the ground, and shoulder is vertical to the ear. Okay. These are the examples of deviation of our normal spinal curvatures. As age progresses, there is high chance for progression of the or violation of our normal curvature. So we will be able to maintain the curvature by proper posture as well as strengthening of the posture muscles. These are all pictures of normal spinal curvatures. So this picture shows how we need to sit on a computer. See, the monitor should be at the eye level, chin should be parallel to the ground. He's maintaining lumbar lordosis, and the thighs are parallel, and arms are well supported, and knee and foot is 90 degree, almost 90 degree. This is the way we need to sit on the computer. For a computer professional, he is sitting sedentary for a long time and without any exercises. This can induce so many strain to soft tissues like muscles. So in between intermittent stretching, simple stretching exercises can relieve the tension on the muscles. Intermittent break and intermittent stretching is good. This slide shows why do we exercise. Exercises can increase bone density, bone strength, muscle strength, joint mobility, posture stability, and thus prevention of fall, relieve or decrease pain, and also it induces confidence. These are some common mistakes we used to do every day. So these are the bad postures which we used to have. So we need to correct our posture properly with our maintaining all our curvatures. See, sedentary sitting can cause strain on the lumbar spine as well as thoracic and cervical spine. So we need to have a proper sitting posture with upright posture. This is a picture which is showing how we need to maintain the normal posture. Here the cervical lordosis is being disturbed, thoracic kyphosis is being exaggerated, and there is no lumbar lordosis. And regarding walking, we used to come across so many persons walking like this. This is the normal way of walking. Here it is being extended backwards. Here it is stooping forward. This is the proper position for walking. And nowadays, all students are with mobile, with online classes. This is the position, the way to sit properly. See, the lumbar lordosis is being properly maintained. Chin is parallel to ground, and this is being properly placed so that there won't be any strain to neck or eyes. And now we will go through some activities of our daily life. Whenever there is a neck pain, the usual advice is avoid pillow. Is it right? We need to have a pillow, but a small pillow is absolutely needed to support the neck. So if you are using a two pillow, there are high chances for exaggeration of our normal curvature or diminishing of our normal curvature, which can cause strain and spondylotic changes. And whenever there is a back pain, there is an advice, we need to avoid the mattress. Is it good? So we need to avoid the foam mattress and have a firm mattress. So I have told about driving posture, bike riding posture, sitting posture, lying posture, and many things we used to come across on our daily life. I think we'll be able to have questions if anyone have.
Yes, sir. Thank you so much for the wonderful session, sir. Now, shall we move on to Q&A, sir?
Yeah.
So we have a question from Mr. Ananta Krishnan. He says like, please tell us whether vertigo can be cured by physiotherapy.
Yes, vertigo can be cured effectively with physiotherapy, but sometimes we may need to have medicine along with the physiotherapy maneuvers to correct the balance. When there is a disturbance in the movement of the cochlear fluid, we may get vertigo. So we need to reposition it. There are exercises with physiotherapy to reposition it effectively, and sometimes this giddiness or vertigo-like features can cause with the cervical spondylosis also. We need to find out whether it is due to the cause is due to from the ear or from the cervical spine. We need to find it out, and we have effective maneuvers for clearing it. With the 2 or 3 sessions of physiotherapy, most of the vertigo problem can be controlled, and the patient can do it as home exercises.
Okay, good, sir. Now we have another question from Antakrishnan. Whenever we have a knee pain, particularly beyond 60 years of age, the orthopedist invariably suggests a knee replacement surgery. Isn't there any physio treatment for this universal old age problem?
Yes, sir. Yes, sir. If the person is 60 years and if he's having any pain, definitely the possibility is osteoarthritis. For osteoarthritis, physiotherapy is very effective, but it depends on the stage. If there is no joint space or the articular cartilage is fully worn out, and if there is severe pain, we doesn't have any option other than replacement. If there is a appreciable joint space, we will be able to cure the symptoms. See, with the osteoarthritis, patient will be experiencing pain more on the inside part of the joint, and the mobility will be less. Whenever we are trying to move the joint, there will be severe pain, and due to dysfunction, there are chances for getting weakness of the muscles around the knee, which further worsens the situation. So we need to have an X-ray to find out there is the extent of degeneration, and if the degeneration is not so severe, there are good chances to have a pain-free life with physiotherapy. Okay, we need to strengthen the front muscles, quadriceps. Usually it is being strengthened everywhere, but we need to concentrate more on the hamstrings muscle also, because quadriceps is anti-gravity muscle, which will be automatically strengthened to a certain extent. The hamstrings muscle is being ignored, and we need to strengthen the hamstrings muscle also. When there is a pain, there are chances for the patient to walk without extending or without straightening the knee. So it can cause weakness of the vastus medialis, that last knee extensor muscles. So we need to cure the pain with the physical modalities and strengthen and mobilize the joint to regain the function. If it is severe, we need to go for replacement surgery followed with rehabilitation with the physiotherapy. The replacement doesn't cure itself. After replacement, proper physiotherapy is needed to regain the function.
Okay, so then we have another question from Ms. Akhila Gauri. I think we have already discussed about this, but still I'm raising the query. That is, for flat foot, if identified in a very early childhood, can physiotherapy help?
Yeah, if it is due to weakness of intrinsic muscle, we can effectively strengthen the intrinsic muscle, and we'll be able to get the arch properly. Usually, we need to start from the early childhood. Okay, if it is acquired due to some injury or anything, we will be able to correct it. Sometimes it can occur congenitally. So we need to analyze it, whether it is structural or due to muscular. If it is a muscular reason, we can strengthen the intrinsic muscle before the arch is getting collapsed. If the arch is being collapsed, it is very difficult.
Okay, so we have another question from Mr. Chandrasekharan V. For a child, shoulder ligament injury in a boy 10 years old, what is the prognosis for coming back to normal activity?
Depends on the extent of injury. If it's a tear, you need to have an arthroscopic surgery. If it's a partial tear, with the physiotherapy and rehabilitation, he will be able to regain the movement. And also depends on what is his daily need. If he's a sports person and if he's having a tendon injury, he might need a tendon repair followed with the physiotherapy. Usually 90% of the problems around the shoulder can cured effectively with the physiotherapy, proper physiotherapy. We need to analyze the cause, basic cause for the injury, and we need to correct it and cure the symptoms followed with the strengthening.
Okay, sir. We have another question from Narayan, sir. He's asking if you can recommend something for neuro related, especially for brain.
Means?
So I think he's asking if any impairment happens to neurology or neuro related area, what is your recommendation from physiotherapeutic area?
So there are a lot of neurological problems like Parkinson's and difficulty in walking. So many issues are there. For that, physiotherapy is affecting. I think he was intended to ask for about stimulating the brain in case of dementia, like patients. Repeated activity can stimulate the brain. Working on pegboard, working on pictures can stimulate the brain so that the memory can be maintained to a certain extent with the physiotherapy.
Okay, sir. Then Shubha ma'am was having a concern. I'm having diffuse disc bulge at L4, L5, L5S1, thus facing severe back pain with pain radiating towards legs and the pain. So I'm also having cervicular radiculopathy now with pain radiating towards the shoulder and elbows. So I guess, she's sharing her concern towards us, expecting some recommendation from your side.
Yeah, definitely. She may improve with physiotherapy. As I said, the disc is being bulged and it is being compressing the nerve, mostly the sciatic nerve, and which is giving symptoms of pain down the leg. And also the cervical nerve root is being disturbed and which is giving radiating pain to the arm. This can be effectively cured with the physiotherapy. We need to examine the patient for any weakness or any other neurological symptoms. I think she will 100% benefit with the physiotherapy treatment and maybe some postural correction or lifestyle modification. She will be able to cure it effectively.
Okay, Shubha ma'am, hope you heard that. So next is a question from Dr. Ravindranathan Kesey. Is there any permanent cure in physiotherapy for recurrent disc prolapse of a single arm? I'm referring to the shoulder socket joint. It is not that it is due to the weakening of tendons.
Ma'am, can you repeat the question?
So he's asking, is there any permanent cure in physiotherapy for recurring disc prolapse of a single arm?
No, ma'am. It might be recurrent dislocation of, not disc. It might be recurrent dislocation of shoulder.
Okay, I hope Ravindran sir, could you please make a clarification on that?
No, the disc is in the spine and the shoulder. He's asking about the shoulder.
Yeah, shoulders of the joint.
Yeah, it might be. He might be asking about a recurrent dislocation. There are two types of dislocation. There is structural causes there, and muscular causes there. If it is due to muscular cause, we will be able to correct it effectively if that prolonged dislocation doesn't make any damage to the structures. The structural causes the joint is formed with a glenoid cavity and a head of humerus. If the shallowness of the glenoid cavity is not proper, it's a structural cause. If the shallowness is being given by a structure called glenoid labrum, if there is an injury with the glenoid labrum, he has to go for surgical correction. And if it is due to a muscular cause, physiotherapy definitely will help him.
Okay, sir. Then we have some few positive comments from Shamala ma'am, Srikumar sir, and Ravindranath sir. Thank you so much. So they were praising your presentation skills. So yeah, I hope we are getting many more positive comments. So thank you, sir. Thank you so much. I think we can close the question answer session with that.
Okay.
Thank you so much, sir. And now I am inviting Nandan, sir, for word of thanks. So please.
Yeah. Good evening, all. So happy that we have concluded the 46th talk of the Intersociety weekly webinar series. And today's session on physiotherapy, a key to pain-free life, was really interesting, informative, and knowledgeable. So let me come to my duty, which is to deliver the word of thanks. The speaker of the day, Mr. Sreejith M Nampoothiri, who is the Director and Chief Physiotherapist, Executive Center for Physiotherapy. He very well explained about the different stages of physiotherapy, then the fields of applications. He also explained about the simple exercises to reduce strain, the various sitting, driving, walking postures, neck postures, etc., so on and so forth. So it was very nice, listening, various strains, right, from food, then knee, shoulders, tennis elbow, student's elbow. A lot of, it was a really informative session. So overall, it was very, very much informative. You can see from the chat box itself that all the participants enjoyed a lot. So on behalf of all partnering organizations, I would like to extend a very sincere thanks to Mr. Sreejith M Nampoothiri for spending your valuable time with us, giving a lot of information, sharing a lot of knowledge with us, and for patiently answering the questions of participants. Thank you so much, sir, for your efforts, for your time, and your support.
Thank you.
I would also like to thank Harindlal sir for being the backbone of this weekly webinar series. Thank you so much, sir, for arranging wonderful speakers and the diverse set of topics. I would also like to thank Mr. Murugesh Kumar and Ajina, MC of today's session, for helping us to successfully conduct this event, this webinar. And a very special thanks to all the office bearers of the partnering organizations and our seniors, VKD sir, Suhair sir, Kurit sir, and all are here. Thank you so much for your constant support. And last but not the least, I would like to thank all the participants for patiently listening to the session. I hope you enjoyed a lot. And thanks for your active participation by asking questions through chat box. Once again, thank you so much all. Thank you. See you next week.
Thank you so much, Nandan sir. Nandan sir was representing Intersociety Trivandrum Chapter. Thank you so much, sir. Now, as we are coming to the end of today's session, I would like to announce the next talk in our series of talks. On next Wednesday, the 3rd of March, from 6 to 7 p.m., we'll be having a 47th talk of Intersociety weekly webinar series on Mission Critical Intelligence for Public Safety by Ms. Shanti Ravindran, Principal Architect, Next Gen Experience Public Safety Solutions. I request all our dearest attendees to kindly take a note on this and register for the session. So here is a goodbye from our 46th talk. Hope to see you all on next Wednesday as well. Thank you so much, Sreejith sir, Nandan sir, everyone for joining us. That was indeed a great session for the day. So here I announce the meeting of the day officially closed. Thank you so much.
Thank you, Murugesh Kumar. Thank you, Sreejith Muralidharan. And thank you, Ajina.
Yeah, thank you, sir. Thank you.
Good night to all.